My name is Asha Chhablani, and I'm a clinical associate in the Department of Surgery. I am a trained general surgeon. I've been doing this for the past 32 years. Though I do some amount of general surgery, predominantly my work is breast surgery. I do about maybe 125 to 150 mastectomies a year. I believe the decision to become a physician was already made for me. I didn't make it consciously. I remember ever since I was a child, that's all I wanted to be. There were no physicians in my family. It's just something that came to me naturally. My parents always told me that even when I played with my toys, I was their physician. The decision to become a breast surgeon, again, I believe was already made for me. When I first finished my training, there were very few women in surgery, and the female patients just gravitated to me. I connected with them, and I felt that was my calling. I felt very satisfied helping women with their problems, and they felt that they could open themselves up to me. Well, I had a bunch of colleagues who I'd known from the past, some of my ex-residents also, who were at the university and told me what a great place it was to work. And just knowing there was a great place for learning, great place for teaching, the whole environment, the medical school, the multidisciplinary approach to breast problems. I like the team approach, particularly in breast surgery. It's from the moment the patient even calls to make an appointment. It's all just coordinated very well. Our coordinator, Ramela Lee, actually first gets all the information. She gets all the x-rays, the slides, and then everything is sent to the pathologist and the radiologist. Working with the radiologists, who are just outstanding, Dr. Newstead and her team. They pick up lesions which others miss. And then working with the oncologists, both the radiation and the medical oncologists, working with the plastic surgeons, Dr. Song and his team, the anesthesiologists. It's just state of the art. It's very satisfying and very gratifying to be surrounded by all that knowledge and talent and expertise. It's stimulating having very young residents and smart medical students around. That's what attracted me here. Well, it's very personal. I'm greatly indebted to my nurse, Donna Christian, who's just like my right hand, and she and I work together. It's the whole team. Like I said, Ramela Lee, PJ at the front desk, Renata, who's our nurse coordinator. And then we communicate on a personal basis, on the phone, email. Patients can reach us anytime of the day, 24/7. It's not a problem. I always encourage the patients to bring their families, especially once the diagnosis is made and the treatment is planned. Because there are times when the patients are so overwhelmed with the diagnosis they may not kind of pay attention. So if their families are there, we encourage that. I've had maybe 8 to 10 family members at a time, so. I believe a woman should choose the University of Chicago Breast Center because we provide holistic, total care to the patients from the moment they walk in till their care is completed. We have a team approach, we have a multidisciplinary approach. We are surrounded by a lot of talent, including our radiologists, our oncologists, our social workers, Dr. Olapati and her team, the Cancer Risk Clinic. We just are surrounded by a lot of talent.